So the reason that we undertook this research is because at the beginning of the COVID-19 pandemic, the provincial chief medical officers of health, so essentially the top doctors in each province, they were actually getting a lot of attention about how they were communicating about COVID-19 with the public. And so in most provinces, they were issuing daily or near daily press releases that were discussing the implications of COVID-19 in their province, what people needed to know, how they should be responding. But there really wasn't a cohesive message from across Canada. And there was a certain amount of criticism around that, suggesting that greater consistency was needed between provinces and across the country. And so we actually decided to take a look at those press releases and do an assessment of what kinds of messaging were being presented in each province and what level of consistency there was across jurisdictions and over time as we learn more and more about the pandemic. So we looked at all press releases that were issued by or with the provincial chief medical officers of health, starting in January, which is when the first press release was issued in BC, all the way up until the end of March, which is the point at which all provinces had declared states of emergency, schools were closed, and just a lot more was known about COVID-19. So we looked for emergent themes that kept coming up. We looked at the dates on which major milestones were happening, like when was a state of emergency declared, when were schools closed, and then we looked at consistency. So how did those messages vary between provinces, and how did they change over time? Ultimately, we ended up looking at 290 different news releases, and what we found was that despite the fact that there were 10 different provinces issuing different press releases, their messaging was actually remarkably consistent. And there were 4 sort of broad themes that we noticed, which were messages around emergency preparedness and the government's capacity to respond, the recommendations and mandates, such as social distancing, limits on gatherings, closures of public spaces. There was reassurance of the public, letting people know, this too shall pass. And then the last one was really aimed around promoting public responsibility to help contain the pandemic. And those themes changed over time. So at the beginning, there was a general tone of reassurance that gradually became more focused on recommendations for slowing transmission, and then ultimately really emphasizing that point that everyone has a role to play in slowing transmission. So our findings suggested that the messaging between provinces was actually really consistent, which might have a lot to do with the fact that the provincial and federal governments were actually in really regular contact with one another throughout the pandemic, and where there were variations between provinces, this was actually really appropriate in light of their local circumstances. So COVID-19 has not affected all provinces in the same way and with the same severity, and the messaging from the chief medical officers of health reflect those unique circumstances in their jurisdictions. And it would actually probably be very difficult and maybe even confusing for Canadians if there was only one message as a kind of one-size-fits-all message that was applied to the whole country, regardless of local realities. And so as such, we actually contend that the ability of provincial chief medical officers of health to issue recommendations that are tailored to their audience and to their jurisdiction is actually a strength rather than evidence of a lack of coordination.